Good morning, everyone. Just realized that I had my last slide up live, which I'm guessing you didn't want to see. You want to see the beginning, so quickly just toggled through. It's great to be with you here this morning. I am starting a little bit early. So hello and welcome to this next OET All-Stars streaming event. My name is Neil Harris. I'm joining you from CELT, Cardiff. We are an OET All-Star and Premium provider for nursing and medicine. It's great to be with you today. Can I just ask you, please, if you can, in chat, share with me the following information. Can you tell me, please, your name, where you are from, and also which OET profession you are studying for? It might be nursing, it might be medicine, it might be one of the 10 other OET professions. But do share that with me in chat as an opportunity for us to get started. Okay, so welcome everyone. We've gone live and I'm just waiting for people to join us in chat. So I've just rewound the slides to the beginning for today's OET streaming event, where we are looking at listening part B and how to ace that part of the test. Just looking to see how many people we have with us in chat this morning. It's great to have you here. Thank you for joining us. So as I say, if you could share with me, please, in chat where you're from, the OET version of the test that you are preparing for, be it nursing, medicine, or one of the other parts of the test, but also just to let me know your name and where you're from. Okay, great. I can see we've got messages coming in already. Jody is in Saudi and is preparing, Amjad is in Saudi and is preparing for medicine. Good morning. Dr. Fahim, medicine, I guess, Pakistan. Ria, a pharmacist. Good morning, Ria, joining us from New Zealand. We've also got some nurses, Amin from New Zealand, Cyril from Ghana, Lucy joining us from Zambia, Dr. Peace from the States. Good morning, Dr. Peace. A few more doctors and nurses from Pakistan, Asma and Humaira. If I read all of the names, we'll be here for a very long time. So forgive me if I don't read out your name, but it is great to see you here with us today. So you've already heard me request the details of where you're from and which profession you're doing. Just remember, for reading and listening, everyone does the same version of the test. So whether you're a pharmacist, rather like Ria joining us this morning, a nurse, a doctor, or indeed anything else, you'll all be doing the same version of the reading and the listening tests. So what are we looking at today? How am I intending to help you? Well, in terms of the content and the learning outcomes, I'm going to share with you in a moment what it is that you will be learning in today's session. Learning if you're new to OET, or perhaps revising if you've already started on your OET preparation journey. So we'll look at the outcomes, what you'll be able to do better at the end of the test, at the end of the session, than hopefully you're able to do right now. I'll give you a quick overview of the entire listening subtest for those of you who are perhaps a little new to OET, and then I'll focus in more detail for listening part B. I'll spend some time with you looking at strategies and tips for success in listening B. And then I'm going to introduce 3 sections. The first, listening for the answer, helping you to focus in on what is it that OET wants you to listen for. We'll then consider what distractors are My friend and colleague Scott from Swoosh did a session on distractors the other week. So this will be useful revision if you saw that session. And then we'll put it all together with 2 OET listening Part B questions. There'll also be time at the end for Q&A. So in terms of the learning outcomes, what can you expect from today's session? Well, hopefully by the end, you will have developed further familiarity with the overall format of the OET listening subtest. If you're new to OET, what can you expect in the listening test? And that'll be true for either the computer-based or the paper-based version of the test. You will have demonstrated your understanding of the Part B in terms of its format and its focus. What does it look like? What is it testing? And also to be able to use appropriate strategies and the tips that I'll be sharing with you for success in listening Part B. So let's dive in and look at Part B. And let's not forget that final listening outcome, which is increasing your confidence and the accuracy of your answers in this part of the listening test. If you've got any questions relating to listening Part B, you can, of course, ask them in chat at any time. Otherwise, there'll be a time for longer Q&A at the end of today's session, which I'm expecting to last between 50 minutes and an hour. Okay, so the listening subtest overview. What does OET expect of you, and what does it ask you to do in the listening test generally? Well, as you're probably aware, the listening test is divided into 3 sections. Today, we're looking at the middle one, listening B. Listening generally, you get a total of 42 marks. And you need approximately 31 in order to achieve an OET B, also known as an OET 350 in listening. And that mark of 31 out of 42 is also the mark that you will need for OET reading to get the OET 350 that so many of you need. There are a total of 6 marks available from the OET Part B. So in that respect, it provides you with the smallest number of marks when you compare it with listening A, 24 marks, and the remaining marks from listening C. Now, if you're new to OET and you'd like even more information about the listening test and also listening Part B, then a fantastic place to go is the OET website. If you look across the top of the site, oet.com, you'll see a tab called Ready. Click on that and it'll give you a sub-menu including listening. And as you can see from the screen grabs, which I'm sharing with you now, there are some sample tests, including some videos. There is a link to the OET blog and the posts relating to OET listening, and also some videos to help you. Notice on the blog that there is access also to OET's own complete guide for Part A, Part B, and Part C listening. And those are really useful resources. Now, many of you I know are interested in other resources to help you to prepare for the test. And that's what the next slide is about. At the end of today's session, I will be sharing with you my email address with 2 slides as a free takeaway from today's session. So if you wait until the end, when I share the details of this with you, you'll receive a list of sites that OET has recommended for developing your listening generally, and also a list that I've curated. Brings together lots of the different links on the OET website. So you've got everything in one place. And that will be available either by staying to the end of the session and then getting my email address, or alternatively, if you can't stay until the end, don't worry, because this session will be going on to YouTube. You can watch the end in your own time and then email me for those links. So that's our takeaway to help you. Right, so let's move on. Let's start thinking a little bit more about listening part B itself. And for those of you joining us for the first time, Annette, hello. Hi, Mercy. I see you're like me in the UK. Good morning. And of course, good afternoon or good evening to those of you in other parts of the world. So, listening part B, what is it all about? Let's find out. So, as I've already indicated, there are 6 marks available in listening part B, and they come as a result of you listening to 6 short recordings which come from the workplace. Typically, you will hear a person or a group of people talking about a situation that you will be familiar with from your work-based settings. Each question is followed by 3 option multiple choice, and you have to choose which option fits the answer best. You have about a minute in total for each of the 6 questions. So 6-7 minutes for the entire part B of the test. And 6 questions, 6 marks, therefore 1 question per mark in part C. And in fact, that's true for the whole of the OET test. Each question is worth 1 mark. Let's have a quick look at the focus of listening part B. What is it actually looking at? What are you listening to? Well, the test, and this is information from the OET website, states for listening part B, you are identifying detail, gist, opinion, or purpose of short extracts from the healthcare workplace. And I would encourage you to see listening part B as really being about big picture. What is the person talking about? What is the problem? What are they discussing? It's less about detail, it's more about the overall meaning of the communication that's taking place. And these come from settings which, as I say, you will be all familiar with, such as handovers or team briefings. In terms of the format, what do the questions look like? What exactly is required of you? Well, here is the information you need. As I say, 6 short extracts lasting slightly less than a minute. They will be in the form of a communication between, for example, 2 healthcare professionals, 2 colleagues talking to one another. It might be a patient with 1 healthcare professional, or it might be 1 healthcare professional briefing the team in some form of handover or giving important updates or information about the workplace setting. As I say, 3 multiple choice options. So your job is to choose which option, A, B, or C, represents the content of the communication. In the computer or OET at home, you click on the lozenge that you think is correct. In the OET paper-based version, with your pencil, you shade in, completely fill the lozenge, the little, it's not a circle, it's elongated. Completely fill that in with your pencil to indicate which is the correct answer. Some people in the paper-based version of the test lose marks because they don't shade it in correctly or they put a cross. No, you shade in the lozenge. Computers mark this part of the test. B and C in listening and reading are scanned in and they're optically marked, whereas part A of listening and also part A of reading are marked by people. Just as a additional bit of information, some people don't get the score that they want in listening and reading, and therefore they think about having a retest. Strongly encourage you, don't do that. You can't rely on a retest for any part of the test. People, perhaps if they do use it, do so for reading and for speaking, as they are entirely marked by people. And just be aware that marks can go down as well as up or stay the same. I think I'm right that in 2021, no one who requested a remark of the listening or the reading had any marks changed at all. So, in that respect, the mark you get is the mark that was correct. Okay, so a bit more about the format. This is the good news. You're given 15 seconds to look at the question before each individual recording. Now, if you're doing the paper-based version of the test, you can actually underline keywords. And I personally find that quite useful. In computer-based or in the OET at home, you're just going to be able to read them and consider what you think is important. The passages last about 45 seconds. Add that to your 15 seconds of reading time. That gives you about a minute per question. You then get 5 seconds to mark the answer at the end of the recording so that you can choose which answer, shading the lozenge in paper-based or clicking on the right option in computer-based is the right one. And this means that part B, shortest part of the listening test, it lasts about 10 minutes in total, slightly under sometimes. Okay, so what kind of things do you need to know in order to be successful in listening part B? These are the official strategies which are taught by OET providers who have undertaken training with OET themselves. If you go onto the OET website, you'll be able to look for the OET preliminary providers, the OET premium providers. They've undergone extra training, plus those of us premium providers who are also OET All-Stars. So this is recommended strategy and tip training. Some of you may be part of WhatsApp or Telegram groups that are not official. Be careful of those, because quite often I see people sharing advice that is actually wrong, and it will make your experience of the exam more difficult. So always look for training, and I really recommend this OET All-Stars at OET Official. Sorry, wrong way around, at Official OET on YouTube as being the best source of information for those of you looking for high quality, low cost training. So let's start with the first strategy. Before you hear the recording, remember you've got 15 seconds. Use that time, and this is the point at the top, to look at each task and look at the questions and think about what are you going to hear. Take those 15 seconds to read through the question so you know what information and the ideas that you're listening for when you hear the recordings. So you'll be given a context, that's at the top. You'll be given the question, I call that the stem, and then the 3 answers. And I'll talk a little bit about how the relationship between those works when we look at the section called Listening for the Answer. Do remember, if you've got questions at any time, you can pop those into chat. I'll answer straight away if relevant, or I might delay the question until later on. Let's look at our second strategy. And in this one, we're actually going to be looking at what a question in part B looks like. So there you go. This is, in fact, one of the practice questions we'll be working with later. And you can see, in fact, that it is divided into 3 main parts. At the top, you've got the context. So it's a radiologist talking to a patient about the MRI scan that he's going to have. And we know that the patient is a man, he. We're told in the next part, the stem, the question, that we can infer that the radiologist is a woman, her main reason for talking to him. So we already know what we're being asked is, why is the female radiologist talking to the male patient? And then we get the 3 options that follow. It's important that you pay attention to all 3 parts: the context, the stem, and the options before the recording starts. So in terms of your OET development, get into the habit of being able to understand and to process the meaning of the context, the stem, and the options, everything that's here in 15 seconds. Okay. Moving on. A new strategy. This will work for the paper-based version of the test, not for the computer-based. But it's true that for computer, at home, and paper-based version of the text, you should be focusing on key words, I call them here important words and concepts, in the question before the recording plays. And by that, I mean keywords in the context, the stem, and the options. So radiologist, patient, MRI scan, reason for talking. Explain the procedure, reassure him concerns, clarify why test necessary. So it's just a quick overview of the main ideas that are presented to you. You will only hear the recording once, and you need to record your answer at the end of the recording in those 5 seconds. So please remember, unlike some tests where you may hear the recording twice, OET you only hear it once, you need to listen and record your answer, shade the lozenge, click on the button at the end of the recording. Don't think, oh, I'm not sure, I'll come back to that one. You won't remember. And there are no negative marks in OET. You won't lose a mark if you put in the wrong answer. So if you're not sure, go with the one that feels the best. If you have no idea at all, choose one letter and stick with it. As I say, there are no lost marks for incorrect answers. So this idea of sticking with a letter is the monkey score. Only use this when you just don't have any idea at all of the answer. You can choose just A, just B, or just C. And the idea of this monkey score, if you've got half of the questions and you're confident of the answer and you choose it, good. If the other 3 you've got no idea, if you stick with the same letter, statistically, you've got a 1 in 3 chance of getting one of those remaining 3 correct. So your answer, you may get 1 more. So when you don't know an answer at all, fill something in, fill in the same letter. Moving on to some final strategies. This is a gist question primarily, asking you for your overall understanding of the passage. Like reading B, like listening C and reading C, it is unlikely that the answer that you hear will be repeated in the same words in the question options. Rather, the correct answer will paraphrase, use synonyms to test your understanding. So if you hear an answer that uses mostly the same words that were in the recording, it's probably the wrong answer. Maybe they've taken the words and added a word like not or never to totally change the meaning. You hear the words and think, that's the right answer. And you miss the fact that it's taken a positive in the recording and made it a negative in the options. So look for understanding. This is why OET is an exam that is for people who have a lower advanced on the CEFR C1 level of English. It really probes your understanding of what you hear and how it can be explained in different words. So my top tip always for any part of OET is start your preparation only when you have a really good language level. High B2 at least, preferably C1. Okay, so those 5 strategies that I shared with you, they're now all on screen for the same time. We don't share the slides with you, but if you have your tablet or your camera on your phone handy, or you can do a screen grab, this would be an opportunity just to take a picture of this slide with all of the strategies in one place. So we're now going to move on and talk about practicing this part of the listening part B. So I'll just pause now. Remember, you can ask questions in chat if you'd like to. Alternatively, stay around for the practice. But yeah, I'll just pause now to give you a few seconds in order to take a picture of this slide if that's what you'd like to do. Those of you who have just joined us, we're about halfway through today's webinar, and I've just paused on screen for a moment to give you the chance, the opportunity to take a picture of this slide, which puts together the 5 strategies that we have discussed so far for OET. I'm going to move on now, but don't worry. If you've missed part of this session, it's fine, because it will be uploaded very soon to the OET YouTube channel, the official OET All Stars channel, where you'll be able to watch it at your leisure again or at another time. And just to remind you, if you are staying around for the end of the session, about 35 minutes away, then there will be a free giveaway in which I will share with you my email address so that you can request 2 slides that will be really helpful, I hope, for your OET training in terms of the listening test. So let's move on, and let's think about this all-important idea of listening for the answer. I think what happens with OET and similar exams, IELTS to an extent as well, is that when you've got a multiple choice answer, it's very easy to get distracted and think, well, it could be this, maybe it's that. Don't. Your focus should be on these, not on the test on screen or the test on the exam paper beneath you. You should be focusing on listening to the passage and answering the question. And by the question, I mean that middle bit, the stem that comes immediately above the 3 options. So how does it all work? Let's have a look. So at the beginning of the listening part B, you will hear in the recording played, if you're in a test center, probably loudspeakers, if it's paper-based. If it's a computer-based version of the test, you'll be wearing headphones. And if it's OET at home, you have the choice. It is really important, by the way, that you get used to listening to OET in the format that you will hear on test day. So if you're doing OET in a paper-based center, do your OET practice with a loudspeaker. Don't use headphones, because it does feel a little bit different. Likewise, if you're doing OET in a computer-based test center, or if you're doing it at home, get used to listening with your headphones in, because that's what will happen on test day. And being familiar with what happens on test day is one of the tips for being as comfortable, relaxed, and as successful as you can be. So be it on the loudspeaker, paper-based version, headphones, computer-based OET at home, you'll hear this reading, this bit of information that tells you what OET looks like. Okay, they're the instructions. So remember my first strategy, which was for paper-based versions of the test at least, to underline important words in the question before the recording begins. So you should be looking at the context, the stem, and then the keywords in the options. So can I ask you, and you can do this in chat, what do you think are some of the keywords? You can type these in chat if you like, to demonstrate what you think matters here. Remember to focus on context, the stem, and the options. If you don't want to put it into chat, I mean, that's okay. That's no problem. But it will give you an opportunity to think about what's the key information here. I'll pause a few moments. If you want to reply in chat, you can, and then I'll share with you my thoughts about this. So if you're just joining us, we're now looking at how you can start processing the question for meaning. And I've asked each of you to consider what are the keywords, the important ideas and concepts in the question in all three parts, in the context, the stem, and the options. And I'll share what I underlined if it were a computer-based version, sorry, a paper-based version of the test. So I identify it's an optometrist talking to a patient. It's a dialogue. And the patient is trying contact lenses for the first time. Now, the patient has concerns. So as I'm listening to the text, I'm trying to find out what are the patient's concerns. Is it to do with blurred vision? Is it to do with soreness in the eyes? Or is it to do with how to remove the lenses? Okay, let's have a look at the next question, question 26. Same strategy. And thank you very much indeed for Eru Rabina and is that Chaco, I think, for having identified that they think the keywords include optometrist. Yeah, that gives us the context. Patient concern, definitely. In question 25, that's really what we're listening for. Why is the person concerned? Ayman is asking a question, is it allowed to underline words on the answer sheet? In the paper-based version of the text, yes, it is. In the computer-based version, an OET at home, no. Okay. Yeah. So a lot of you now are sharing in chat the word concern, good, because that's really what this question is about. The patient's worries, if you like. Well done. If we move on to question 26, we're going to do the same thing. If you're doing paper-based, you can underline this in pencil in the test. If you're doing computer or OET at home, you'd be thinking about the keywords. What do you think is important in question 26? I'll share answers with you. If you've already started typing, that's great. You can compare your ideas with my ideas. So again, it's a dialogue between a nurse and a colleague. And the nurse is asking the colleague for help, and the help relates to a patient in the nurse's care. And the question is, why does the nurse need help? What is the reason for her request? And the reason for the request, colleague, please help me, will be to do with one of the 3 points that follows, A, B, or C. Patient's condition has deteriorated. Patient's worried about a procedure. Patient is reporting increased pain levels. Now, you're not going to hear the word report in C, but you might hear the patient's, you won't hear the patient, but you'll hear the nurse, for example, perhaps saying, oh, the patient told me, the patient is saying, or in B, the patient is getting themselves worked up because of their forthcoming operation. Notice a synonym for procedure. Or I'm a bit worried about this patient because their situation has got worse overnight. Notice all of this use of synonymy, of paraphrase. Okay, so it will have become obvious, I think, as we've talked about this, that one of the keys to success in listening part B is focusing in on the stem. What is the patient concerned about in question 25? Why does the nurse need help in question 26? What I think is really useful is putting this into your own words as a demonstration of your understanding of the question. Gets your brain warmed up. So you might be thinking about, for example, what are the patient's worries for question 25, or what is the patient worried about? In question 26, what support, what extra help does the nurse need and why? Okay. Now, if I'm going to just hide my image on screen, just so I can make this slide a little bit bigger. Hopefully you've been able to print this out in advance as well. And it's going to seem a bit strange that I'm not playing you the recording, but can you have a look at question 25? And can you find where in the passage we get information about the patient's concerns? At what point is the patient worried? In question 26, where do we learn about the reason for the patient needing help? If you'd like to share your answers in chat, that would be really useful. So look at the transcript. Where can you find the answer to the question? I'll pause a few minutes to allow chat to catch up and for you to share your answers. So the question here is, where in the passage can you find an answer to what is the patient worried about? What is the reason for the nurse requesting help? Now, what's happening here is that by listening for the answer to those questions, it will help your ear to process what you hear. That's not a patient worry. That's not a patient worry. Now this is a patient worry. And it therefore helps you to focus in on the right option based on answering the question that you have in front of you. Let's have a look. So Asma has suggested there is something about blurred vision. Okay, let's have a look. Thank you, Asma. Right. So the patient has a concern. Things look rather distorted, though. I mean, I can't make out the letters on the chart. Everything else is not a current problem. Patient expected them to be a bit more uncomfortable, but actually that's fine. Had no problem taking them out. Is not confident about putting them in, but the optometrist explains, well, that's not likely to be a problem. The patient, the third thing they tell us is that everything's not very clear. Things look rather distorted. And that takes us back to A being the correct answer, his blurred vision. Okay, let's do the same for question 26. Well, question 26, the nurse says that the patient needs her chest drains removing, though, and she's got herself into a bit of a state. Now, if we look at question 26, the patient's condition has deteriorated. Actually, it has leveled out okay. The patient is reporting increased pain level. The patient is worried about a procedure. This isn't an operation. It's the removal of a chest drain. And she's got herself into a bit of a state. She's worked up, she's nervous, she's worried. So hopefully what I've been able to demonstrate here is that by focusing in on the stem and listening for information that answers the stem, we get the right answer. Okay. Distractors. You will have noticed, even when I was talking about why this listening gives us the correct answer, we were also able to argue against some of the other options. So in question 25, I said, for example, that the patient expected discomfort, but actually didn't have any. That the patient is perhaps worried about pressing too hard putting them in, but is fine taking them out. And this relates to distractors because soreness in the eyes, well, that didn't happen. Removing the lenses, he said he was fine with that, a bit nervous about putting them in, but in fact it was blurred vision, the distorted vision, that was the issue. So this speaks to this point about working with distractors, with the how OET tries to trick us. If you listen for the answer, your understanding, your processing will enable you to narrow down onto hopefully one correct answer. And you'll be able to reject other bits of information as not relevant. If you don't focus on the answer, but you focus on the options, then what's going to happen is, by looking at the written questions more than listening to the text, you might be attracted to an answer that is wrong. So I come back to this point that in listening B and in listening C as well, really focusing on what you hear and finding an answer to what you hear using synonyms and paraphrase is the way to go. So question 27, going to give you, you'd have 15 seconds in the passage in the exam. So I'm going to give you 30 now. As before, what I'd like you to do, please, is identify what are the key ideas, the key words in question 27. Okay, and then we'll do the same for question 28. What do you think are the key ideas in this question? And again, 30 minutes or so, 30 seconds, sorry, to focus in on the key information in the question, context, stem, and options. Okay, let's have a look. So in question 27, hopefully this is what you identified. It's a senior nurse probably talking to a team about a new initiative. Why was the new initiative introduced? What problem does the initiative solve? So when you're listening, focus just on that. What initiative, what problem does this new idea, this new procedure solve? At the end of the recording, go back to the option and choose the one that links using synonym best to what you hear. You will, if you focus on options A, B, and C whilst you're listening, you will hear something relating probably to all of them, and that will confuse you. That's the distractors working. So, as I say, focus on your listening, not the options, and try and answer the question from what you hear. So, when you get to the end of the recording, then you can decide, is it a problem of patients being confused by what the doctors tell them? Is it the inability of relatives to talk about problems with a doctor? Or is it about patients not discussing everything, all of their concerns, all of their problems when they meet the doctor? Likewise with 28, context, two radiologists, and they're discussing a scan. They have obviously got some different options, but they choose one of them. You're listening to the option which, and then you've got to find out, okay, well, they've chosen this one, why? And at the end, when you've heard them discuss this, you'll be able to choose, was it an option which enabled them to view the whole of the appendix? Was it the one that gave the most accurate results, or probably the most accurate results? Or was it the one that presented the least number of dangers, of risks to the patient? Okay, let's have a look at distractors in a bit more detail. So distractors are ways in which the incorrect answer takes you away from what you actually heard and understood. So it's important when you choose your option that it is correct in all parts. So for example, if we have a look at C, if you've heard in question 28, it's the one that has the fewest number of risks to the patient. You've got to make sure that it's not just one risk, but a combination of risks. If you think it's A, it's not enough that you hear them saying, oh, this will enable us to see the appendix, but to be able to see all of the appendix. In other words, every part of the option you choose must be correct. Look for words like never, probably, most, mostly, some, because these can change the meaning from what you hear into a distractor. If something is partially true, so you've identified 3 parts of the answer as being important, but only 2 of them are matched in what you hear, this is probably an incorrect option. Words like always, never, all, some change the meaning. If you see in the option the word all, but in the recording you heard them talking about most, again, it's wrong, even if the other parts of the option are what you heard. Again, be careful of this idea of word spotting. If you hear in the recording words that are almost completely similar to the option A, B, or C, then that one is probably incorrect. OET uses a lot of paraphrasing. You'll also sometimes see in OET an option which seems to make common sense in the real world, but actually it's not mentioned directly and clearly in the passage. So for your correct answers, what should you expect? Well, remember, it's what you heard. That was your focus in the 45 seconds of the recording. It will reuse, it will rephrase the words in the correct option. It will match the option in every part. And remember, OET doesn't do a trick where it will say we've got 6 questions, so we've got 2A, 2B, 2C. OET is random in that respect. You can't say, oh, I've had lots of A's so far, so the next one can't be an A. It could be an A anyway. Use all of the options all of the time and choose the best one. Ignore what options you've already had previously. Okay, cool. So with that in mind, let's have a look. And again, I'm going to move the screen around a little so that hopefully you can see the text a little bit better. There we go. Right. Okay. So in question 27, we knew that we're looking for a solution to a problem. And at the bottom, we hear the senior nurse saying, patients used to say that they only thought of the things they felt they needed to discuss when it was too late. So the cards give them a better chance to bring up whatever's on their mind. So patients, because they're sick, because they're perhaps not focusing as well as they would normally do, don't have in their mind all of the things that they want to ask the doctor at the time when the doctor is visiting them, giving us the answer C. They're not discussing all of their concerns when meeting the doctor. Now, you might think, well, what about B? And we hear the word family. But notice, they can also talk to their families during visiting time and even on the phone and see if there is anything else they'd like to add. Now, relatives, family, but different situation. The family is able to talk to the patient during visiting time or on the phone to check whether there is anything that the patient should add when they see the doctor. It's not about not being able to discuss issues. That's not mentioned. So be careful of picking up on words like relatives, think you hear family, choose that as the option because everything else in there is incorrect. Let's move on and look at the next one. I think this is even clearer in terms of how distractors work. So this was the conversation between two radiologists, and they have a discussion where they consider different methods in terms of the kind of scan that they will give the patient. And I'll just give you a few moments to read the dialogue between the female and the male radiologist. So they're having a conversation regarding a CT scan or an abdominal ultrasound. And they start off with the female suggesting the abdominal ultrasound because it avoids the risks of the radiation. And the male asks, well, is accuracy a problem? And the female replies, well, sensitivity is less, but specificity is the same. So no, accuracy isn't a problem. Notice the word accuracy in the recording matches accuracy here, but accuracy isn't the issue. We know that the sensitivity is the same, so that's okay. So the male agrees with the female. Okay, so we can avoid the dangers, the risks of contrast exposure. They don't use the word risk, they don't use the word danger, they talk about a type of risk. Links in with C. And then they come back at the end to this, and this is where it's trying to trick you. If we can't visualize the complete appendix, then we can recommend an abdominal CT. There's nothing in this discussion talking about the merits of seeing or not seeing. They're really more focusing on, are there dangers and what's the best decision to avoid the danger to the patient. So although complete appendix matches what you hear, the whole of the appendix, and although accuracy is linked in B, because we have listened for the answer, we realize that C is the best option. Okay, let's move on. So this is where you get to put it all together. We've discussed and I've shown you the importance of focusing on what you hear to answer the question. I've focused on looking at the questions, the context, definitely the STEM plus the options, and then making a decision on which is the best, being aware of how distractors try to confuse you. So what we're going to do now is, in fact, try 2 OET questions. I'm just going to need to bring up my recording, which I've realized, apologies, is in the wrong place. Let me just cue this up. Won't be a second.
Or the child being subject to contrast exposure as well.
Okay, great. So we're in the right place. Hopefully you'll be able to hear the recording fine. I'm going to go back to the slides. And I'm going to give you some time to read question 29, and I'll then play you the recording. I'll give you slightly longer than the 15 seconds. But what we're doing here is we're training the skill rather than putting you into exam conditions. Okay, let's play the recording for you.
No. Question 29. You hear part of a surgical team's briefing. Now read the question.
Okay, next is Miss Malloy's repeat laparotomy. Any anaesthesia issues?
We don't expect any particular problems. He's relatively fit and well, except for his epilepsy, which is under good control. His BMI is 35, but
Will we need the obesity bed?
it shouldn't be an issue.
And what about the epilepsy post-operative management?
He's taking his oral medications, and we can use an IV if necessary.
I know he was in a lot of discomfort after his last surgery, and this time he's going to need a larger midline incision. It may be worth thinking about an epidural. He's certainly at the extremely low edge in terms of pain threshold.
Question 30. You hear a senior research associate talking about a proposal to introduce...
Okay. I'm just going to bring the slides back up again. So you think about what you have heard. You have the surgeon talking about the fact that this is a follow-up surgery for the patient. We hear that there is an issue with the epilepsy. We hear there is an issue with the obesity. And we hear that the surgeon comes up with a solution for overcoming this. So, what do we think? Do we think A, B, or C? I'm just waiting to see some of the answers coming through. We've got some answers coming already. We've got a suggestion for A. We've got a suggestion for B, another suggestion for B coming in, lots of suggestions for B coming in. Okay, Queen V, I'm sorry that you're having trouble with the recording not being clear. Other people seem to be okay, so you might just maybe turn up your volume a little if that's possible. Okay, so the vast majority of you are choosing option B. Let's have a look and see why, and well done, B was the correct option. So in question 29, the surgeon makes a suggestion thinking about an epidural. Notice the word suggest in the question. So this is something that the surgeon is putting forward, recommending as a possible solution. And we hear that in when he says, it may be worth thinking about, and he recommends an epidural. So that gives us the answer B, benefit from a specific anesthetic procedure. Notice the word epidural doesn't occur at all in B. This is why we need our high language level. Rather, we have the synonym of specific anesthetic procedure replacing epidural, with it may be worth thinking about linking to suggest. So why is A incorrect? Well, we know that the patient has epilepsy. We don't expect any particular problems. He's relatively fit and well, except for his epilepsy, which is under good control. Obviously, BMI is high, 35. Will he need the obesity bed? It shouldn't be an issue. So if you chose A, good that you have noticed the paraphrase of obesity bed into specialist equipment. But notice the negative here. It shouldn't be an issue. Now, also, we know that the male surgeon is making a suggestion. Will we need the obesity bed? For me, that is more a genuine question than it is a suggestion. Okay. C, risk of complications from another health issue. Well, the other health issue, the distractor is mentioned, epilepsy, but we know it's under good control. So there is no risk considered for the, in terms of complications. Okay, so if you chose B, as many of you did, well done. Now let's have a look and do the same, but this time for question 30. Again, I'll give you some time to read the question. Remember, your job is to answer what hasn't been established about the teams yet. What do they not know? What have they not decided? That's what you're listening for. Then choose your options A, B, or C at the end. Bit of reading time, focusing on the key ideas. Okay. Recording coming up now.
Associate, talking about a proposal to introduce interprofessional primary healthcare teams. Now read the question.
We're looking at opportunities to improve the effectiveness of health and healthcare systems here in Canada. One of the interventions we're looking at is interprofessional primary care teams, groups of professionals working together collaboratively to provide services including healthcare, social services, and advice to patients within the primary care setting. There's evidence that teams like these can improve chronic disease outcomes, including diabetes, hypertension, and heart disease, as well as mental health problems. There's also evidence that improvements can be made in terms of both access to and coordination of care. Now, the extent to which these teams could affect the costs of healthcare in such areas isn't quite clear within the evidence, but the work we're doing aims to address such issues while looking at the challenges of implementation and evaluation.
Okay, so listening for what was not yet established, something that isn't agreed or isn't clear. Do you think from listening to the passage, is the answer to that question A, B, or C? Again, share your answers. Maybe put Q30 and then the letter A, B, or C. That'll be really helpful so I can make sure that it is this question you're answering. And I'll wait for a couple of moments for the answers to start coming into chat. Queen V, you've been able to answer this one. Hopefully the audio is a bit clearer for you this time. We've got 5 answers in so far. The majority of you are going for the same answer. One of you choosing C. Okay, that's fine. A couple of you choosing C now, but still a majority going for B, the financial impact. Well, let's think about what we heard. So we've got a senior research associate, and she introduces the topic. She then starts talking about some of the many benefits that are included. Let's look at the transcript. And I would make the point, when you're preparing for OET, going back and listening with the transcript is actually incredibly useful. So I just need to move the slides on. Bear with me a second. There we go. So she talks about the intervention, the interprofessional teams, and the purpose of this is services including healthcare, social services, and advice to patients in primary care settings. And what are the benefits of this? Well, it might be an improvement for chronic disease outcomes. She gives some examples, plus mental health. But also there is evidence that improvements can be made in terms of both access and coordination of care. So there's evidence that seems to suggest that there is a firm basis for the context in which this can be used. She then goes on to talk about something that isn't quite clear within the evidence, and that is the extent to which these teams could affect the cost of healthcare. So by putting these people together, is costs going to stay the same, go up or go down? We don't know. So, isn't quite clear is our clue. It relates to costs and therefore B, the financial impact. Some of you chose C. Well, in fact, C, the aspects of care they're suited to, we've got evidence, there is clarity in terms of chronic diseases, diabetes, hypertension, heart disease, and mental health. There's also evidence that improvements can be made in both terms of access and coordination. So the aspects of care is covered by an evidence base, making C incorrect. And A, what hasn't been established? Well, the working collaboratively, there's your word spot, collaboration, collaboratively, you hear it, but the collaboration is part of the thing that is clear with an evidence base, so therefore it is established. Okay, so there are the answers to the questions, the first 4 which we talked about, and the last 2 in which you listened. So thank you to the many of you that have stayed for the duration of today's session, and now that takeaway that I spoke to you about at the beginning. The following 2 slides are really useful in terms of attending to your listening skills development. And the important thing when working with medical English is listening to the kind of medical English that is used in OET. So what you have here, coming from Australia as well as the UK, remember OET is an international exam, are some links to podcasts, to websites where you can access for free in the main OET listening type recordings. So that's the first page. The second page is a curation of additional help, places to go to find out more about being successful for OET listening generally and including Part B. So a lot of these come from the OET website, but it saves you looking around. It puts all of them in one place for you. And it also gives you the link to the OET channel at Official OET on YouTube, where you can look for the playlist for listening and review and practice your listening from OET experts like CELT. The final link is to CELT itself, where I work. If you are interested in having paid lessons with us, then get in contact, neil@celt.co.uk. Alternatively, if you're just looking to receive these 2 slides, there is my email address there as well. There it is on the final page. Do get in touch and I will share those 2 pages with you. I'll now hand over to you for any Q&A that you have. Mercy, you've asked me to send links to the life chart. I'm not sure what you mean by the life chart, Mercy. Can you clarify that, please, in chat? And if I can send it to you, I will. Thank you all very much indeed. I do hope that you have found today's session, quite a long one, useful. I'll leave my details on screen a bit longer. And as I say, if you've got any questions, now is a great time to ask. Queen V is asking, when is the next class? Queen V, so the OET All-Stars typically have 1 or 2 sessions a week. So if you subscribe by going to the OET All-Stars page on YouTube, just look for YouTube at Official OET, sign up, and then you'll get notifications of when they take place. There are over 10 of us now, and therefore we take it in turns. So you'll see me again in about 5 to 6 weeks' time. Thank you to those of you for your kind words of thanks. Thank you, Sibin. Thank you, Shazad. Charmaine is asking a question, is there a break in between the listening part? I'm not sure whether you mean between listening A, listening B, listening C. Charmaine, in which case, no. Now, if you're doing the computer-based version of the test, basically what happens is you sit down at your computer and you will start with listening. That's the first test, then reading, then writing. Speaking might be scheduled for later in the day or even on a different day. Now, in the for the purposes of the paper-based version of the test, there will be a slight break between at the end of listening and the start of reading, and then they will collect in reading part A and leave you to do reading part B, and then to change the papers for reading between reading and writing. Then normally lunch, and then the speaking in the afternoon. But within the listening test itself, Charmaine, if that's what you mean, there is no break. They play the recording, it starts with A, it moves on to B, it moves on to C, no break. Adoma is asking for details of paid lessons. Adoma, if you send me an email, neil@celt.co.uk, I can find out the kind of lessons that you need, because we have different options. Alternatively, go to our website, celt.co.uk. If you look across the top, you'll see a tab for courses. Click on that. It'll then bring down OET courses. You can look at the different types that we offer, and then the dates and prices are on a separate tab. Okay, great. Asma, that was really helpful. Thank you very much indeed, Asma. We are here to offer you help and to be as helpful as possible as you all prepare for the OET test. So I appreciate your kind words. Thank you very much. Doesn't seem to be any other questions coming in which case what I will do is bring the live stream to a close. I'm not going to wish you good luck, because that's not what it's about. What I am going to do is wish you success, and it's a great honor as an OET All-Star to be part of your OET journey. Thank you all very much indeed for joining me today. Thank you, and goodbye.